Cefotaxime, also known as Claforan Vial with threaded port, is a medication used to treat a wide range of bacterial infections. It can also be used to prevent infections after certain surgeries. This medication falls into the category of drugs called cephalosporin antibiotics, and it helps to stop the growth of bacteria in the body. It is important to take this medication as directed by your doctor, and to finish the full course of treatment even if you start to feel better. The dosage and timing of this medication will depend on the specific infection being treated, so it is important to follow your doctor's instructions carefully. Always consult with a healthcare professional before starting or stopping any medication. When using Claforan Vial with threaded port, it is important to follow your doctor's instructions for injection into a muscle or vein. If injected into a vein, it should be done slowly over at least 3 minutes to avoid potential side effects. The dosage will depend on your medical condition and how you respond to the treatment. If you are using this medication at home, make sure to learn the proper preparation and usage instructions from your healthcare professional. Before using, check the product visually for any particles or discoloration. If you notice either of these, do not use the liquid. Also, be sure to learn how to store and discard medical supplies safely. If you are using the frozen pre-mixed solution, thaw the bag at room temperature or in the refrigerator. After thawing, shake well and squeeze the bag to check for leaks. It's important not to refreeze the solution after thawing. To get the best results, it's important to use this antibiotic at evenly spaced times. This will help you remember, and for the best results, use it at the same times every day. Lastly, continue to use this medication for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. And as always, be sure to tell your doctor if your condition lasts or gets worse. If you experience any swelling, redness, or pain at the injection site, be sure to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. However, you should inform your doctor immediately if you experience any of the following serious side effects: easy bruising or bleeding, unusual tiredness, uncontrollable movements, changes in mental or mood, seizures, signs of kidney problems, or signs of liver problems. Additionally, seek medical help right away if you experience fast, slow, or irregular heartbeat. In rare cases, this medication can cause a severe intestinal condition due to a bacteria called C. difficile. If you develop persistent diarrhea, abdominal pain, or notice blood in your stool, contact your doctor immediately. Do not use anti-diarrhea or opioid products in this case, as they may worsen symptoms. Extended use of this medication may lead to oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, changes in vaginal discharge, or any other new symptoms. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching, swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects that are not listed here. If you are in the US, you can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Claforan Vial with threaded port, it's important to inform your doctor or pharmacist if you are allergic to cefotaxime or other antibiotics. This medication may contain inactive ingredients that can cause allergic reactions, so it's crucial to communicate any allergies to your healthcare provider. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have kidney disease or stomach/intestinal diseases such as colitis. Cefotaxime may affect the effectiveness of live bacterial vaccines like the typhoid vaccine, so make sure to inform your healthcare professional if you are using cefotaxime before receiving any immunizations or vaccinations. Before undergoing any surgical procedures, it's important to disclose all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products, to your doctor or dentist. If you are pregnant, it's important to inform your doctor before using this medication. Additionally, Claforan Vial with threaded port passes into breast milk in small amounts and is unlikely to harm a nursing infant, but it's best to consult your doctor before breastfeeding. When using Claforan Vial with threaded port, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, such as certain urine glucose tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. If someone has taken too much Claforan Vial with threaded port and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Symptoms of overdose may include seizures. It's crucial to get help right away in these situations. It is important not to share Claforan Vial with threaded port with others. Your doctor may need to do lab and/or medical tests, such as a complete blood count and kidney function tests, while you are using this medication. Be sure to keep all medical and lab appointments to monitor your health. Make sure to take each dose of Claforan Vial with threaded port as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. It is important not to take a double dose to make up for the missed one. Be sure to follow the storage instructions provided with the Claforan Vial with threaded port. Keep it out of reach of children and pets, and do not dispose of it in the toilet or drain unless instructed. When the product is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.